On this Friday night, pandemic predictions of a dark winter ahead. The fears of a fifth wave, Omicron becoming the dominant variant.
This virus keeps dealing us the next card in the deck.
And anxiety over another COVID Christmas. Vaccine decision division.
You don't think it hurts my heart that I can't go?
No, because you're making that choice.
One family on two sides of the immunization debate. Struggling with long COVID.
I also lost my smell and taste again.
The mystery of why some survivors are stuck being sick. And targeting Quebec's religious symbols law. Why critics say the feds need to finally take action.
Global National with Donna Friesen. Reporting tonight, Colleen Christie.
Good evening. Thanks for joining us. We begin tonight with a warning for Canadians planning to get together or travel abroad over the winter holidays. With the situation around the Omicron variant changing rapidly, the federal government is urging people to be extremely prudent if traveling overseas, as it's risky and travel rules could change quickly. For people staying home, the advice is to keep holiday gatherings small, even if you're vaccinated. Right now, the Delta variant remains dominant in Canada, but there's evidence of community spread of Omicron in some regions. Some new modeling shows if it takes hold, case counts could explode in the weeks to come.
This is another bump on the road, and we still don't know enough about the Omicron variant, except that it looks like it's very transmissible. Keeping private gatherings small is actually quite important at this point.
Michael Couteur has tonight's top story on the new projections and what could be in store for Canada if precautions are ignored.
It is tough, and this virus keeps dealing us the next card in the deck.
A blunt admission from Canada's top doctor that she too is feeling the weight of a nearly 2-year pandemic. It came as health officials presented new modeling of where the epidemiological curve could go if the Omicron variant takes hold in this country.
Omicron is not yet prevalent in Canada, has limited community transmission. That is going to change.
Here's how it could change. Right now, more than 3,300 new cases are being reported daily in Canada. If Omicron overtakes the Delta variant and transmission stays the same, it's predicted by mid-January we could see over 26,000 new cases per day. Ontario's top doctor is worried.
As of yesterday, 10% of the samples detected at Public Health Ontario were positive for Omicron. And it's anticipated that we'll have a significant rise in the coming weeks and in the next month.
To increase provincial protection, Ontario is ramping up the rollout of booster shots. Starting January 4th, all adult Ontarians will be eligible for a booster as long as it's been 6 months since their last dose. Other provinces are doing the same, but age accessibility differs. With the threat of yet another wave on the horizon, epidemiologists point out we are better positioned than the previous 4, with more vaccines and more knowledge, which could save us from further health restrictions or lockdowns.
If we can use filtration, ventilation, mask wearing, symptom checks to high effectiveness, we don't need to close things down, quite probably.
Dr. Theresa Tam agrees we have more tools now, but also says we have to look even further ahead beyond Christmas and into March break. And to keep in mind that Omicron likely won't be the last variant we'll have to deal with. Colleen?
Mike, thank you. With the holidays just around the corner, public health officials are urging Canadians to think twice about hosting or attending large parties. Jamie Mauracher reports on what experts are recommending and what you need to know if you're planning to travel overseas.
COVID hasn't stopped Christmas at Toronto's Distillery District, but the arrival of Omicron is forcing revelers like Daria Winch to rethink his holiday trip.
The numbers were spiking like crazy in Germany, and I would say it's just the reasonable decision to delay.
A smart choice if you ask our health minister, who warned Canadians of new, stricter travel measures in the coming weeks.
Things are happening very quickly outside of Canada. And so if they think of traveling, that should be a serious alarm bell, a serious concern for them.
Domestic trips aren't as risky, but
staying closer to home I think, is definitely the better choice.
Keeping gatherings intimate to limit contacts, as well as offering COVID-19 self-assessments, masking when necessary, and of course, getting vaccinated. For Catherine Reeford-Ledlow, a mother of two who's also battling brain cancer, this is non-negotiable at Christmas dinner.
Nobody's coming into our house if they're not fully vaccinated. That's it.
There are ways to sidestep the awkwardness of gathering your guests' medical information. You can make it a little more merry by using a free festive Evite.
We can't wait to see you and enjoy the season's glee. But please show you and yours have tested COVID-free.
Or pick up this Toronto-made Christmas sweater, complete with a QR code so hosts can scan you for your Vax Pass.
Know what the vaccination status is of people you're going to be around. You might have to modify how you do things.
At the Deputy Chief Public Health Officer's home this holiday, friends and family might be a little chilly.
Bring some additional layers of clothing because I plan to also use ventilation to the max and have the windows open for a certain period of time, maybe on the hour, to also improve the circulation of air. So that's maybe a bit of a warning to my family members who are coming over.
Celebrating with stipulations so we stay healthy into a hopefully happier new year. Jamie Mauracher, Global News, Toronto.
Nova Scotia is reporting a spike in COVID-19 cases. Officials say an outbreak at a university is largely to blame. The province says 55 of today's 123 new cases are linked to St. Francis Xavier University in Antigonish. There are now a total of 114 cases connected to the outbreak. It's believed the virus spread at recent graduation events. A high-profile Toronto MP is self-isolating after a potential COVID-19 exposure at a gala Sunday. A number of attendees, including Raptors President Masai Ujiri, have tested positive. Marcy Ian, the Federal Minister for Women and Gender Equality, joined Ujiri at the Giants of Africa event, an organization he created for youth basketball. Proof of vaccination and masks were mandatory. Ian has tested negative, but she went into isolation yesterday after the Raptors announced Ujiri contracted the virus. Turning to the recovery efforts underway in British Columbia after last month's devastating flood disaster, it is shaping up to be the most costly weather event in BC's history. The Insurance Bureau of Canada estimates insured damage at $450 million, and overall costs are expected to be much higher. Many affected residents live in high-risk flood areas where insurance coverage is not available. For comparison, more than $4 billion was claimed after the catastrophic Fort McMurray wildfires in 2016, but most homeowners had insurance. It remains Canada's most costly insured event. Potato farmers in Prince Edward Island are getting financial help from the province. It comes nearly 3 weeks after shipments to the U.S. were suspended after the discovery of potato wart on 2 PEI fields. The program will provide potato farmers with up to $5 million in fixed interest, working or capital loans. The government has also set up wage support for potato exporters and trucking companies. The province expects the ban to extend into the new year. Canada is threatening new tariffs on U.S. exports if the U.S. approves tax credits for electric vehicles made in the States. In a letter to key members of the U.S. Senate, Deputy Prime Minister Chrystia Freeland and Trade Minister Mary Ng say the Build Back Better Act contains provisions that are discriminatory towards Canada, Canadian workers, and our auto industry. They warn Canada is preparing a list of U.S. products that could face tariffs, including the auto sector. If passed, U.S. car buyers could get a tax credit of up to $12,500. Ottawa wants Canadian vehicles and batteries to be eligible for the same credit. Quebec's premier is weighing in on a growing controversy in his province. A popular grade 3 teacher was removed from her classroom this week for wearing a hijab, a violation of Bill 21. The law passed by François Legault's government bans certain civil servants from wearing religious symbols at work. Legault says the teacher should never have been hired in the first place.
It was voted democratically by the National Assembly. I think it's a reasonable law, a balanced law.
Some federal politicians are denouncing Quebec's secularism law, but as our chief political correspondent David Akin reports, nobody seems prepared to do anything about it.
It was one of the big moments in the federal election, a debate question about a Quebec law, Bill 21.
Why the discriminatory laws in your
It was the first question of the night to the Bloc Québécois leader, who was indignant.
Those laws are not about discrimination. They are about the values of Quebec.
Other leaders, then chasing voters in Quebec, turned on the moderator. But after a Quebec school board enforced Bill 21 this week by removing a teacher from her classroom for wearing a hijab, federal politicians were quick to denounce it.
This type of discrimination isn't reflective of the Quebec society I want to live in.
It was so disappointing and
advocates say it's time for federal politicians to act on those impulses and defend the federal Charter of Rights for all Canadians.
That is what we want to see happen, and what every single political party should do is unite behind that, behind challenging the use of the notwithstanding clause.
Bill 21 has already been upheld by a lower court in Quebec, but that ruling is now being appealed by civil liberty groups and Quebec school boards.
It'll be very difficult because it really needs to be looked at in a higher court, not necessarily at the ground level where we are right now.
The federal government, though, remains on the sidelines, saying only it is reserving the right to intervene in the future. Any federal action, though, will be stiffly opposed by provincial powers.
Quebec has made the choice of secularism, and I think it must be respected.
Francois Legault is the clear favorite right now to win office again in next year's Quebec provincial election. And he's sure to campaign on a platform of defending Quebecers' values. Values which include enforcing a law which many outside his province see as discriminatory. Colleen.
David Akin in Ottawa. Thanks, David. For the first time in nearly 2 months, people in Iqaluit can drink the city's tap water. The government of Nunavut lifted the do not consume order today. More than 8,000 people haven't been able to drink tap water since October 12th. The city's water supply became contaminated by fuel. There may be a residual smell in the water, but the territory's health officer says the risk of recontamination is low. A major defeat for the founder of WikiLeaks. Coming up, how Julian Assange is another step closer to being extradited to the U.S. More than 50 people are dead and dozens more are injured after a truck crashed in southern Mexico. Most of the victims are believed to be migrants from Central America, and a warning, some of these images are disturbing. Witnesses say the tractor trailer was speeding when it crashed into a steel pedestrian bridge Thursday evening. It flipped over, causing the trailer to split open. At least 160 people, including children, were inside. Many were trying to reach the U.S. through Mexico. The driver fled the scene, according to local authorities who are investigating the crash. In the UK, a court ruling could potentially allow Julian Assange to be extradited from Britain to the United States. Lawyers for Assange say they'll appeal the decision, which overturns a January ruling that said the WikiLeaks founder could be a suicide risk if he's sent to the U.S. As Redmond Shannon reports, the decade-long saga is far from over.
On every step of the process, Julian Assange has had vocal supporters in his corner.
No extradition!
To them, he's an oppressed hero of the free press, holding the powerful to account.
It's only the ruling class have their way, and it's a tight knit, that's all it is.
But Friday marked a significant victory for the US, potentially paving the way for Assange's extradition.
Of course, we are slightly disappointed. It is very, very difficult to get a fair hearing from a justice system in the United Kingdom in anything which cuts across the perceived interest of the security state.
The High Court here in London overturned a lower court ruling that said Assange may be a suicide risk if sent to the US. The judge accepted new assurances from US authorities that the WikiLeaks founder would not face the harshest of detention measures. Those promises include not keeping Assange in solitary confinement in a maximum security prison, allowing him access to psychological treatment, and the right to be transferred home to Australia if convicted.
Amnesty International has analysed these assurances and have said that they are inherently unreliable.
Assange is facing 18 US charges related to the publishing of diplomatic cables and classified reports on the Iraq and Afghanistan wars. In 2012, he sought refuge in London's Ecuadorian embassy after facing sex assault charges in Sweden, which he denied. The charges were later dropped after prosecutors said too much time had passed. After 7 years in the embassy, British police literally dragged Assange into custody. He remains in a London prison. His lawyers say they will appeal Friday's ruling to the UK Supreme Court. Should they fail, Britain's Interior Minister will make the final call on his extradition. Redmond Shannon, Global News, London.
The two journalists who share this year's Nobel Peace Prize are calling for better protection for independent reporting. Maria Ressa of the Philippines and Dmitry Muratov of Russia received their awards today during a pomp-filled ceremony in Norway. In his acceptance speech, Muratov called journalists the antidote against tyranny. Ressa used her speech to attack social media platforms.
Our greatest need today is to transform that hate and violence, the toxic sludge that's coursing through our information ecosystem, prioritized by American internet companies that make more money by spreading that hate and triggering the worst in us.
The two journalists received the award for their separate fights for freedom of expression in countries where reporters have faced attacks, harassment, and death. Division over vaccination ahead, how opposing views are threatening a family's future.
You're watching Global National.
While the majority of eligible Canadians are now fully vaccinated against COVID-19, there are still some who refuse to get the shot. So what happens when those two sides live under the same roof? Jasmine Pisano has the story of an Ontario family divided.
Noah Callahan could always count on his whole family to be there for his hockey games. That is until his dad needed a COVID-19 vaccine to get into the arena.
It hurts you that I don't go, right?
Yes.
Like in your heart?
Yeah.
You don't think it hurts my heart that I can't go?
No, because you're making that choice.
Paul is the outlier in his family, the only one who's against getting vaccinated. A decision he says is rooted in his faith in God.
His blood is shed all over me, so it's like my shield.
But these are the times of these kids' lives that you'll never ever get back again. And you're missing it all. You're missing it all because you've chosen not to get a vaccination.
The first principle to maintaining relationships, even if you have a difference in viewpoint, is to be non-judgmental.
This family doctor says the first step for families seeking to find common ground is setting aside uninterrupted time to talk.
Everyone gets 5 minutes to say what they're thinking, and then the conversation ends and come back to the table maybe 3 or 4 days later or a week later.
She says giving people that space can create more time to reflect on their decisions.
It's just crazy that some people won't want to get it. I've told them that it's easier to get it because we'll be able to do everything again, like what we did in normal life.
Noah is 11 years old and wants to be vaccinated, but his doctor told him to wait. He was born with a heart defect, and the vaccine could make him vulnerable to side effects. His mom and sister are fully dosed to protect themselves and him.
If you can't do it for yourself, do it for your family. Do it for Noah. We, as the adults, are his protector, and it's up to us to protect him.
The Callahans have had conversations on this for months, but nothing's changed.
You just gotta respect other people's choices.
If they want to come out of this pandemic as a family, acceptance may be their way forward. Jasmine Pisano, Global News, Trenton, Ontario.
Next, the mysterious COVID condition that has many Canadians suffering long after infection. Nearly 2 years into the pandemic, many questions remain around long COVID, the mysterious condition in which patients don't seem to fully recover. It's afflicting a growing number of Canadians. Canada's health agency says about 60% of those diagnosed reported at least one symptom more than 3 months after the initial infection. Robin Gill has been following these cases and joins us with more. Robin.
Researchers, including the team at St. Paul's Hospital in Vancouver, have been busy trying to understand why some patients are still sick long after they beat the disease.
Are there a lot of people still long hauling?
Katie McLean is receiving treatment, and she's part of a research study at St. Paul's. She's been suffering from long COVID for more than a year. We first met her in the fall of 2020 and have been following her journey. At one point, she thought she was getting better. Then she had a major setback.
So I got all my original COVID symptoms from my acute infection back. Yeah, I had shortness of breath, chest pains, palpitations, extreme fatigue, crazy headaches, dizziness. I also lost my smell and taste again. I thought I had COVID again.
3, 1, 2, 3.
Since the start of the pandemic, clinics like this one are being opened all around the world, trying to help patients and unravel why and who is still sick. The syndrome varies, with around 100 symptoms reported.
As far as I'm concerned, we're no closer to really understanding definitively what the underlying cause of this syndrome is. It seems like the virus is like picking random people to impact.
And what is it about these random people? What do they have in common?
I don't know. Yeah, it's still a mystery to us.
To try and answer that question and find out who is more likely to suffer from long COVID, we spoke with leading experts in the field, and their research so far is offering critical clues. Colleen?
Thanks, Robin. To hear about the groundbreaking work scientists are doing in the field of long COVID, watch Robin's full story on The New Reality tomorrow night at 7 on Global. And that is Global National for this Friday. I'm Colleen Christie. Tonight's Your Canada is this skate around the Christmas tree in Pointe Claire, Quebec. We love seeing your festive photos. Please keep sending them to viewers@globalnational.com. Thanks for watching. Robin will be at the anchor desk tomorrow. Have a great night.